Welcome back to the channel where medical topics are made easy. In this episode, we're covering infection and inflammation labs that every nurse needs to know, including Procalcitonin, CRP, ESR, and ACBC with Diff. Now, most nurses just glance at the WBC count and move on. But here's the secret. The real story is hiding in the details. Let's dive in. First up, Procalcitonin. Most people think Procalcitonin equals sepsis test, but that's not true. It's more specific for bacterial infections. So if your patient spikes a fever and their Procalcitonin is high, consider pneumonia, sepsis, or a UTI. But here's a catch: trauma, surgery, and renal failure can also bump it up, so be careful. The key: trend matters more than one value. A falling Procalcitonin means treatment is working. A flat or rising Procalcitonin means the infection isn't controlled. To see the difference, check out this visual. On the left, you see a patient whose Procalcitonin is falling. This means their body is fighting off the infection and the Procalcitonin is coming down because of successful treatment. On the right, you see a patient whose Procalcitonin is rising. This means the infection is getting worse and the treatment is not working well enough. Next, see reactive protein, or CRP, versus erythrocyte sedimentation rate, or ESR. Both are inflammation markers, but they don't mean the same thing. CRP rises fast within hours and falls fast once the inflammation is gone. It's great for monitoring acute infection. Think of it as a sprinter. ESR rises slowly and lingers. So it's better for chronic inflammation like autoimmune disease. Think of it as a marathon runner. Here's a visual to show you the difference. This is typical for an acute infection where the body is mounting a fast response and then recovering quickly once the infection is treated. On the bottom line, you see ESR rising gradually and then declining slowly. This is typical for chronic inflammation, like autoimmune disorders where the inflammation is ongoing and the response is slower. Here's a pearl for you. If your post-op patient still has a high ESR, don't panic. It lags behind. Look at the CRP for real-time info. Last but not least, white blood cell differential. A normal WBC doesn't mean no infection. The differential tells the deeper story. Here's what to watch for: bands. So if you see bands, that means the body is pushing out baby neutrophils. This happens during an acute bacterial infection. So think pneumonia, UTI, or sepsis. It's called a left shift. The other thing to watch for is an increase in lymphocytes, which usually means a viral infection. And lastly, a rise in eosinophils may indicate allergies, asthma, or parasites. Here's a pearl for you. Next time you see a fever with normal WBC, check the bands. Hopefully, this helps you understand infection and inflammation labs. We made this entire series because we know how overwhelming it can be as a nurse. Stop looking at the WBC count. The real gold is in the details. Which lab trips you up the most? Comment below. And don't miss the next episode: lactic acid lies and liver patients. See you next time.